Hey everybody, happy Friday. If you're new here, welcome. If you're returning, welcome back. Today I'm going to be talking about borderline personality disorder stigma within the system towards patients, if that makes any sense. Okay, I wrote this stuff down a few days ago, so it's not like super fresh in my head, but kind of want to talk about it because when I had that borderline personality disorder diagnosis, they would try to talk to us about stigma from the world. They love to blame the ER and the medical community for the stigma when really it's the psychology world that's creating it and educating professionals to be that way. Especially Marsha Linehan. And she is the creator of dialectical behavioral therapy, which is the mainstream treatment program for borderline personality disorder. And before I get into the video, let me just give a disclaimer. I'm not a professional. I'm just a 20-year veteran of the mental health industrial complex. I was misdiagnosed with a borderline personality disorder back in 2010, and I went through some psychiatric trauma as a result, and I am here to talk about it. Okay, so let's get right into it, guys. Okay, according to Marsha Linehan, usually there's not a stigma for no reason. People with BPD are difficult to treat. Yeah, I remember being like, she made this video of a girl she's like treating in therapy, and the girl is being like real bratty and combative and stuff. I was totally like that, and that I could see why maybe if my case manager had watched that video too and maybe saw me acting like that. Well, yeah, it's because there's reasons for that. But okay, so some of the reasons Marsha Linehan feels were difficult to treat is the unaliving thoughts. Therapists don't like it, and that's something that even in recent times, I mean, I was just hospitalized. I've been out for a month. So the unaliving thoughts are often a symptom of when my psychosis sets in. I start getting the unaliving thoughts because I think I just want to not feel that way. I need to like separate myself from the separation. It's hard to explain, but I have learned over time that it is just a symptom of something bigger, and I am the type of person to reach out for help. So, and we're going to talk about this towards the end too. Please never be afraid to reach out for help. If somebody shuts you down, move on to the next person. Most people won't. If they do, it's because they don't know how to handle their own feelings and stuff like that. So, you know, my therapist now, I have to do depression screenings quite frequently, and I'm always really honest about some of my unaliving thoughts, and they've never used it against me. They always say, oh, thank you for reaching out, and that here we'll create a safety plan or whatever. That never happened with the borderline personality disorder diagnosis. They talk about attention seeking, and we'll get into that. Okay. So I also think that my case manager couldn't handle my trauma. This is another reason that therapists might not want to treat a person with BPD is because of their level of trauma. Okay, we're said to have high level of trauma, which is funny because that's my psychiatrist like says that about me now, and when I go to the hospital they're always like, oh, the trauma, but it's like I think 98% of it in my life I have already worked through, and like I'm okay. And so I was never able to do that when I had the borderline personality disorder diagnosis, because what they do in my case is she would use mindfulness techniques. So anytime I would talk about my trauma, she'd like go like this, and then and then try to say, well, what about now? Let's think about now. Let's not think about then. Let's think about now. And therefore, I was never able to work through some of these things. Um, Everybody has trauma, and it's not good to keep it all pushed down. It's good to work through it, you know. Usually, like for me, if I just like talk about it for a second, like with my therapist, I feel better. I don't need all these freaking therapies. Sometimes I just need to talk. Okay, so anyway. Yeah, that's something that they missed back then. So therapy is like DBT, EMDR, in my opinion, allegedly, my non-professional opinion. I think they're more for like normal people who are dealing with a problem. Because when I watch Marsha Linehan's videos, she seems to be under the impression that therapy is just working through a problem. She thinks like mental illness is a series of behaviors. So I think that's where, and therapies can be very triggering to psychotic disorders. And therapists sometimes, if they're not well versed in psychosis, which most of them are not, they might be quick to throw these therapies at you. And I think I've done a video on psychosis between borderline personality disorder and bipolar disorder, but I don't know. I wish I could edit that out. I just rambled. Okay. So, stigma, there is a stigma towards anger and shame. So, to me, okay, back then, I was a very, very angry lady. I had a lot to be angry about. And that is because I had not worked through my trauma. Therefore, I was holding on to some anger about the trauma. And I was also very angry at the way people were treating me. I was being treated poorly, and if I go back to that place, that's the way they treat me there. I don't know why. I'm not treated like that anywhere else in the world. So I was just in a bad place, and I had a lot of anger. I do think anger is a normal emotion. It's part of healing. People with BPD are said to have inappropriate anger. That's also could be said for bipolar 1 disorder, and my inappropriate anger tends to come out during mania and then psychosis. So it's not a normal behavior necessarily for me. And every time I have an outburst of anger like that, I end up in the hospital like the next day or a day, a couple days later. That's usually the end result. And The Simpsons touched on that during the Hurricane Nettie episode. He wigs out on his neighbors and checks himself into the mental institution, and it turns out he has a psych history. It's such a good episode. I think it's either season 8 or season 9. It's called Hurricane Nettie. It's like funny, but it's very raw. It's one of their better episodes. And I like how The Simpsons they almost like gave a voice to the mental illness community by doing that episode. I don't know, very deep stuff. We talked about it in the mental hospital. We were quoting it and stuff. So, anyway, toxic shame is the debilitating sense of shame about self-worth. And some examples of this would be feelings of guilt, embarrassment, and humiliation, feeling unlovable, and difficulty trusting others. Toxic shame, I think, is something a lot of people deal with. Guilt, see, I'm okay right now, but when I get like depressed and stuff, I start feeling that guilt. Embarrassment, yeah, I'll feel that. And then humiliation is an old tactic. That humiliation is something that used to happen back when I lived in that horrible place I always talk about. I don't know why that place is like that or why I was dealt this card in life, but it's okay because I'm living my best life somewhere else. Okay. Um, I mean, I got a lot of problems, but I'm doing okay. Like, I still have a good life, you know? I think Alcoholics Anonymous uses toxic shame, and the criticism I have seen, this is not my criticism, but identifying as an alcoholic carries, oh, my kids were fighting. Okay, identifying as an alcoholic carries a negative connotation. So if you always refer to yourself as an alcoholic, you're sort of, I don't know if like putting yourself down is like the right way to put it, but you're imposing a negative connotation onto yourself by doing that. I think they use toxic shame by dwelling in their past. It's like they teach you to never get past what you did, and it's a cult. I don't like Alcoholics Anonymous, and I have many reasons why. I've done a video on it. I really ought to do an updated version because I could start like intertwining the parts about my boyfriend and all the shenanigans and stuff like that. Okay. So people with BPD have high levels of shame. The treatment is said to be designed to help you feel less shame and cope. However, the professionals say and do things that make you feel shame. I remember, yeah, that they would try to make me feel ashamed about things that I felt good about myself about. Like, can we talk about the stigma of mood? I have bipolar 1 disorder, and I am no stranger to mood. I think that it's a superficial thing about bipolar disorder, and unfortunately, in this superficial world we live in, the professionals are gonna say, oh, it's a mood disorder. It is so much more. So much more. I don't know about bipolar 2, but bipolar 1 with the psychotic features is like the magical mystery tour. Okay. So mood is a temporary state of mind or being, which implies that mood in general fluctuates. I think with bipolar in general, the fluctuation in mood might be a little bit more extreme. Maybe that's why it's disordered. I don't know, but BPD is like a mood personality disorder or something like that. It's, see, my problem is the medicalization of mood. I think mood is a personal thing. It's not really up to others to take note of it. Like, it's really annoying, like, when my peers, nobody's done this lately, this, like, really stupid lady I used to work with, used to make observations about my mood all the time when hers was all over the frickin' place and you never knew which one you were getting on which day. Yeah, so, I get a little touchy about the mood thing. So, with the borderline personality diagnosis, she was always checking that off, in a box. Now, with bipolar 1 disorder, I take surveys, like depression and anxiety surveys. And in that regard, it'll kind of show it'll track my mood in a way that isn't invasive. I don't know, because they're asking me a series of questions. They're not just like, what kind of mood are you in? Check. Because I think that's what more often than not happens with therapists and professionals. Like my last therapist I had was like that. I'd be talking, everything would be going great, and then she'd be like, how's your mood? Like, what does it look like? It look like I'm okay? But what she was saying was, like, what has your mood been all week? And it's just like, oh, she's bipolar, I better ask her what her mood is. So, yeah, and this kind of overlaps with the BPD thing, but in this case, it's very invasive and they medicalize it. There's an expectation to always be in a good mood, If you're not, you're flawed, even though this is unrealistic, because for some reason, everyday people, it is not normal to always be in the same, if not good mood, for the average everyday person. But if you have a borderline personality disorder, they put this expectation of having to always be in a perfectly good mood on you. It's similar to the state of Zen. Nobody's in a state of Zen. But they place that expectation on the BPD sufferer. Okay, my last thing I wrote down is stigma of attention seeking. Okay, so here's just some of the stigmas. People with BPD have a stigma of being manipulative, difficult, untreatable, and attention seeking. Now, this is according to Dr. Daniel Fox. I got this off of one of his videos. Some of the attention-seeking behaviors would be saying things to get a reaction. That is like literally the world we live in right now. That is every news headline, probably title to YouTube videos. Like, so I think that's common. I put a question mark next to that. Learned helplessness is something I never, had. I've always been independent, and even my mom has always said, regardless of what I've been through, I've always held a job, and I've always taken care of myself. I'm pretty well taken care of now, but back when I was a single mom, sharing your troubles on social media, guys, share away, okay? Could he be referring to the grievances I have towards, oh, no, I'm not saying he's talking to me. I'm just saying that, like, could he be referring to the grievances people have with the mental health system? Like, sharing your troubles on social media? Like, you should be able to... That's how you reach out. That's how you get help. I would rather people share their troubles on social media than feel alone in life and isolated. I just think that's I think it's a very common thing that people do, and I think it's a really dangerous thing to accuse somebody of. Self-harm threats and behaviors. Now, I think this is what I talked about earlier in the video. So this is a really dangerous concept on their part, because if you make self-harm threats and you have self-harm behaviors, you're not attention-seeking. You need help. Okay? And there's something about this borderline personality disorder diagnosis in general that they want to keep you out of the hospital. In my opinion, of course, that's so the other professionals don't catch on to the crap that they're pushing. And I got some support in that when I went to the mental hospital this time. So, no, you guys, if you're like having unaliving thoughts, I think my husband's home. Okay, reach out. That's all I got. Okay, if you're having those thoughts, reach out. We're all here to help. Okay, I'll see you guys next time. Bye.